Mhm. Hello, everyone. Again, thank you for joining the Healthy Home and Asthma webinar. We will begin in the next couple of minutes. Thank you.
Hello, everyone. Thank you so much for joining today. We're here at the Healthy Homes and Asthma webinar. We're going to get started in the next minute or so. Thank you so much for your patience.
Welcome, and thank you for joining the Healthy Home webinar today. I am Consuelo Pernia from Esperanza Community Housing Corporation in South Los Angeles, and I will be moderating today's webinar. Before we begin, I would like to start off with some webinar logistics. Everyone on the webinar will be muted. If you have a comment or question during the presentation, please use the chat box to send a chat to all participants. The presenter may miss a comment if it is a direct message. The webinar will be recorded so you can watch it again in the future if you wish. The link for this recording will be included at the end of the webinar. At the end of each webinar, there will be an evaluation that will open in a separate window. Please take a minute to fill out the survey to help us make each webinar better. Thank you in advance. This SPAR webinar series was developed from the Asthma Management Academy, a professional development opportunity developed in 2016 by the California Department of Public Health, Esperanza Community Housing Corporation, and Comité Cívico del Valle. The Management Academy was developed for community health workers and health educators to support them in educating their asthmatic clients on self-management and prevention. Our topic today is Healthy Home. We will be hearing from a clinical subject matter expert, a community subject matter expert, and an advocacy SME. They will discuss a South Los Angeles partnership that supports clients in controlling asthma through supporting healthy homes. They will also discuss barriers clients face when they live in unsafe housing and identify strategies to help overcome this barrier. Please check out our Facebook page. We will start by introducing our presenter. Next slide. Okay. Our clinical expert today is Dr. David Bolur, who studied history and biology at UC Berkeley and earned his medical degree at St. George University in Grenada, West Indies. Dr. Bolur has been working at St. John Ware Child and Family Center since 2014. During his time at St. John Ware Child Family Center, Dr. Bolur has worked to bring awareness to the condition faced by children living in poverty in South Central, children impacted by Central America violence and maternal depression. In 2017, Dr. Bolur led an initiative to screen new models for depression, utilizing the PHQ-9. Dr. Bolur is famous at St. John Ware Child Family Center for his beat heart and ability to connect with patients. We have with us two community health worker experts, Marjorie Aparicio, who has worked with Esperanza Community Housing as a community health promoter for 20 years. She focuses on healthy housing and supporting health clients to improve their health through controlling indoor conditions. We have two with us, advocacy expert Edna Monroy, who is the director of Outreach of Strategic Action for a Just Economy, SAGE. SAGE has been a force for economic justice in Los Angeles since 1996, focusing on tenant rights, healthy housing, and equitable development. Edna works to support and protect tenants through connecting tenants with legal resources and providing education on tenant rights.
For Esperanza, collaborating is huge. And it takes a trained eye and trained ears to work with the community, especially in South LA, since there's so many issues and disparities. And the way that referrals work as a collaborative is that they're bidirectional. Esperanza can refer to St. John's can refer to SAGE, and vice versa. And the respect that we have for each other's expertise is very, very important to us. So I respect Edna's expertise in tenant advocacy. I respect Dr. Bolur's expertise as a doctor, and they respect the promotora's expertise being in the community and working with the community of South Central. So for us, respect and believing in what we do is very important to us. As you could see, there's some numbers, and these are the numbers that we have referred to each other. 45 to SAGE and Esperanza, 30 to Esperanza and St. John's. And my name is Gabby Gonzalez, Project Manager for the Healthy Homes Project. Welcome, Dr. Bolur. Next slide, please.
Hi. Hello, can everyone hear me? Yeah, I think so. Thank you so much for the introduction. That was very kind of you. Really appreciate it. Yeah, I'll just get started. I'm going to give a little bit of an overview of asthma and how we diagnose it and how we treat it. And just going to try to highlight how important the collaboration with Healthy Homes is to make the diagnosis and to bridge the gap between patients and healthcare providers, because there's a big gap, and the Healthy Homes initiative bridges that. Yeah. So let's start with the slides. Okay. So, you guys added some nice pictures. Thank you. So asthma is a unique disease because we diagnose it by conversation. So patients have to trust me when I tell them that they have asthma and when I tell them that they need to take medicines. And I don't have the advantage of giving them a blood test and showing it to them and saying this is asthma. And that's why it's so important to have people like Gabby Gonzalez and have Esperanza who know the community and can build trust and get patients to buy into what we're saying and what we're trying to educate about. So okay, next slide. So yeah, I just wanted to talk a little bit about how I started learning about asthma and how my understanding of it has evolved. In the beginning of my career, I was an EMT in South LA, and the image of asthma was kids having lots of trouble breathing, mask on their face, just like this little kid here, and it was pretty obvious and apparent that the kids had asthma. But as I moved on from hospital and ambulance settings into a more clinic and outpatient setting, I got a much more appreciation for the subtleties of asthma. So next slide. Okay. So whereas on the ambulance, the chief complaint would be wheezing, shortness of breath, and it seemed like we had a common understanding that this was an urgent matter and we needed to treat the asthma. In the clinic, a lot of times asthma is less apparent. Usually the chief complaint comes in as a frequent cough, and convincing patients they have asthma isn't as simple as the hospital, where things are more scary and parents may be listening to you a little bit more carefully. Convincing them that they need to take controller meds is even more difficult. So I want to talk about that a little bit more later in the future slides. But first, let's go to the next slide and just talk a little bit about asthma by the numbers. So there's 5,000 deaths per year attributed to asthma, and 2.5 million hospitalizations or ED visits, and that's something I understand working on the ambulance and the hospital, and I saw that firsthand as an EMT. I had a 3-year-old that actually died in the ambulance on the way to the hospital from asthma, and so I really got a sense of that really early. However, that last point about millions of school and work days per year was something that wasn't immediately apparent to me, and just speaks to more of the subtle or the more under-recognized burden of asthma in our society. So next slide. Okay, so we can't really talk about asthma unless we talk a little bit about the disparities. So in terms of prevalence, you can see that Black non-Hispanics have a lot higher prevalence than white non-Hispanics and Hispanics. However, it's maybe not even double when you look at the maroon, the graph for Blacks. It's maybe 1/4 more. But if you go to the next slide, you'll see that although prevalence in African Americans is hardly double that of whites. The mortality is triple or more. So what explains these disparities? We can't just say it's a difference in prevalence. Let's go to the next slide. So these are explanations that have some evidence behind them that might account for the drastically higher mortality among African Americans compared to whites. One thing is distrust for the medical system, and that's something that is very well addressed through the Healthy Homes Initiative. It's probably too long to go in on this presentation, but there's a long history of why African Americans have a disgust for the medical system, but that's something we need to be aware of, and that might lead to less use of controller meds and then more severe exacerbations and higher mortality. There's also some more evidence recently that ACEs, adverse childhood experiences, might contribute to more severe asthma. There's also implicit bias and racism that definitely play a role, as we see not only in asthma but in other diseases as well. And there probably is some genetic component as well. For example, if you look at Puerto Ricans, they're the one Hispanic group that has a very high rate of asthma as well. And coincidentally or not coincidentally, Puerto Ricans have a much higher higher amount of African ancestry compared to other Hispanic groups. So there may be something genetic about the severity of asthma and African heritage. So, okay, let's go to the next slide. So really, when we see these disparities, it shows us that really we have to build trust, and that's what the home program is about. Making the diagnosis of asthma takes repeated visits and repeated conversations to have patients come around and buy into what you're saying. Next slide. Okay, so yeah, one thing that I'm learning, and one thing I'm learning is that there's differences when I have conversations with African American families and Latino families. African American families have a very high familiarity with asthma, with medical terms, with steroids, and the familiarity with steroids also I see in a fear of steroids as well. And they're very good at suspecting, or many of my patients often suspect the asthma before I do, and mention it to me. And it's often more severe in African Americans, and it's a higher burden in that population. I'm learning more and more about the nuances of diagnosing asthma in Latinos, where there's less familiarity with it, and oftentimes allergies are somewhat of a foreign concept, and the language barrier leads to more of a need of lots of conversations and explaining what asthma is. The biggest thing in both populations is the resistance to using chronic meds for asthma, and fear of side effects, fear of addiction, and also an unawareness of the full impact of the environment on asthma, of what's contributing to the asthma in the home environment. So that's something I see like across the board is that if the patient's feeling well, there's just definitely resistance to using a chronic med when the patient's feeling fine. Okay, next slide. Probably did a little bit too many slides because I got to finish up soon. So the symptoms that often lead me to diagnosing asthma can be subtle and not so obvious. So a cough that is so bad that it makes the patient vomit, a cough that makes it difficult to catch a breath, wakes you up at night. When I hear all these symptoms, oftentimes I'll tell the patient right then and there they have asthma, and many times they're shocked to hear that come out of my mouth, and oftentimes they'll come back for follow-up visits and be unaware that I had told them on the prior visit that they have asthma. So there's a subconscious resistance to this idea of asthma sometimes because many reasons, but we won't go into all of those right now. So next slide. So in addition to the symptoms sometimes being under-recognized, the home environment is as well. So some studies have shown that 40% of the total risk of being diagnosed with asthma before you're 6 years old is residential exposures. So next slide. So this is a slide of all the different allergens that people with asthma are sensitive to. And the highest ones you can see are in the middle of the chart. There's roaches and alternaria. Alternaria refers to mold. So mold and cockroach infestations are a huge factor in the development of asthma. And those two problems are much higher in inner cities and with our population in South LA. The top one up there is also a big one. It says D. pityriasis, a big scientific name, but basically that's dust mites. Dust mites that live in sheets and bedding. Those are the big ones that lead to asthma. Okay, next slide. So these are common ways in which families interpret asthma symptoms and oftentimes prefer to think about them. Bronchitis, throat infections, just a bad cough. Maybe it's the weather, like clima, or maybe it's not really asthma. It's just my kid needs the inhaler whenever they're sick. So these are the types of things that we need to talk about and take some time to steer patients kind of away from not away, but to kind of explain what asthma really is. Next slide. So not only patients, but healthcare providers will often skirt around the diagnosis of asthma with things like reactive airway disease. Oftentimes, pneumonias are diagnosed many times in the emergency room, where in reality, the patient's having asthma. Croup is another common one, but really, many of these kids, many of these kids who have these different diagnoses in their medical charts, what they really have is asthma. So next slide. So many families really would just like to get some amoxicillin so that cough goes away and the child goes on his merry way. But the reality is that many children are going to need to carry a medicine with him or her at all times. The disease is never going to fully go away, but it can be managed very effectively, and the sorry, 1 second. Yeah, so I'm gonna finish up soon. I didn't realize how long this presentation was gonna be, but let's do this. Let's see. Okay. Yeah, I can send these slides out to everyone later, but we can move on to the chart. Let's go. So keep going. Keep going.
Is that the chart?
So yeah. This is a chart. So there's been many studies to quantify the effects of home visiting programs. This was one in Dallas that was started, and after the implementation of this home visiting program, ED visits fell by 31%. A lot of these studies have shown that ED visits will fall when there's a home visitor that helps educate the family. And then let's just go to the conclusions. So really, what I really was trying to emphasize in this presentation is that the diagnosis and the treatment of asthma are difficult ones sometimes, and without trust and a conversation, we're not going to improve the outcomes of our patients. And that trust is built by repeated visits, listening, and someone coming and to the home and understanding how that home dynamic is. And I'd just like to say, yesterday I had a patient that had a home visit, and they came in and knew all the names of the medicine, and it was shocking to me because I would say 1% of my patients know the names of the controller inhalers. So I was really impressed. I struggle with that a lot with my patients, trying to make them understand what controller medicines are for and how they work, and so that's a huge advantage for the home visiting program. But if there's any questions, I'd be glad to answer them.
Thank you, Dr. Bolur. Now we will hear from Anna from SAGE.
Hi, y'all. How's it going? Thank you so much for having me be part of this webinar. So I'll be talking very briefly about some of the work that we do here at SAGE, and also through the Healthy Homes Collaborative that we have with St. John's and also with Esperanza. Next slide. So our work starts really here every Tuesday. So we have a weekly tenant action clinic every Tuesday from 4 to 7 p.m. here at our office. And this is a self-help model. What does self-help mean? Self-help means that we provide tools and support to tenants, because we believe that everyone is an agent of change. And so we provide that hands-on support by teaching tenants about their rights, teaching tenants on how to defend themselves, how to protect themselves, depending on the issue that folks are experiencing. This can range from lack of repairs, availability, meaning there's a lot of bed bugs, roach or rodent infestations, mold, a lot of harassment, tenants being forced to sign cash for keys, buyouts, meaning that folks are offered fast cash to leave, which they do not have to leave. They do not have to accept it under rent control. and also people dealing with a lot of landlord harassment, physical, verbal, and even sexual abuse from landlords and managers. And so we support with a little bit of that. And then we obviously refer folks over to St. John's if folks don't have a medical home and are in need of medical assistance, meaning folks have asthma, folks just really need urgent medical care, and to Esperanza if folks need additional support and are located within South Central LA. Next slide. And so I'm going to talk very briefly about rent control and tenant rights. This is part of the advocacy and the information that we provide here at SAGE. So just for folks that might not be aware, might not be as familiar with the LA RSO, LA Rent Stabilization Ordinance of 1978, aka rent control. It is a law, a city law that passed back in 1978, thanks to the support and engagement and organizing efforts of directly impacted tenants that organized and pushed LA City to pass a law. We have rent control. And so, as we know, this law is not enough, given that a lot of people are out, so they don't qualify for any rent control, and or rent control properties and buildings are getting demolished. And we're going to talk more about that. So just a quick overview. So again, there's this law, right? And so a lot of people don't know whether they are protected by this law. And so we talk about this during our presentation every Tuesday. And so essentially the main requirements to see if you qualify for LA rent control are the following. The property has to be within the city of LA. So unfortunately other cities do not qualify, such as Gardena, Inglewood, although Inglewood has their own rent control now, and again, thanks to the organizing efforts of community members, and so on. So it has to be within the city of LA. The second requirement is that it has to have 2 units or more, meaning that unfortunately single-family homes, which counts as 1 unit, are not covered. However, there is a difference between unincorporated county areas, and I'll talk more about that. So again, 2 units or more. And then it has to be built, the property has to be built before October 1st of 1978. So again, right, if it's an older property, an older building, most likely does qualify for rent control, but unfortunately, newer buildings do not, given this law, this statewide law called Costa-Hawkins, that limits rent control expansions to newer properties. And folks tenants that come to our clinics, we are definitely able to confirm with them whether they have rent control or not. And so you could also check for yourself if you have rent control or community members have rent control by going to LA ZIMAS. So this is a website that the LA City has. So it's called zimas.lacity.org, or you could also call the housing department directly, provide to them your address, and they'll be confirming with you whether they have rent control, whether you have rent control or not. Also, very important to note that although, right, people might not be able to be covered by rent control because, for example, it's a single-family home. But again, the advocacy piece to it is that, let's say you meet all the requirements, but it's a single-family home, but technically it's not a real single-family home because it was illegally subdivided, or there is a garage in the back that is unfortunately being rented out because of the housing crisis, right? There aren't enough affordable places for people to live. And so that would be a case by case. And so again, right, even though the law states this, as advocates, as organizers, it is our job to push the envelope and push the city of LA to recognize this property as rent control. And there is a whole process. So I just want people to know and not get discouraged that just because you don't meet certain requirements, you might be out. So that's a little bit about the law. Next slide, please. Okay, and so basically under this city law, there are three types of rent increases. And so the most common ones are two, which actually they just went up starting July 1st of 2019. It used to be 3 to 5%, but starting this new fiscal year, it went up to 4 to 6%. So under rent control, right, we have protections, and one of them is that the rent is capped. It's limited as far as like how much the landlord can increase your rent. And so what LARSO says is that if you are paying for your own utilities, so your energy, your gas, etc., the landlord can only increase your rent 4% with a written 30-day notice. And so if you yourself as a tenant pay your utilities, the landlord can only increase 4%. But if the landlord pays for the utilities, meaning that you are paying for rent and your utilities are included in that payment, the landlord can increase your rent 6%. And again, this is through a written 30-day notice. And so it's really important for people, for tenants, for everyone to know that these increases can only happen once a year, once every 12 months, not every 4 months or every 2 months, once every 12 months. And it's also very important to remember that tenants have to receive the proper written notice, not a verbal notice, not a phone call, not a text message. It has to be the correct 30-day notice. Also, I want to just really quickly highlight that there is a 10% rent increase, and this 10% increase takes place when there is a new tenant that is not part of the original lease, meaning that, let's say your first original lease says that you can only have 5 people, and there's a 6th person that moves in. The landlord has 30 days to essentially confirm that this is a new tenant and provide you with a 60 written 60-day notice to let you know that there is a new person living there and that the landlord has the right to increase your rent by 10%. And this is called constructive knowledge. So the landlord, the owner, has to have sufficient evidence to increase your rent. They cannot just say, I've been seeing this person come in and out, or this person has been staying over for 3 days. So again, it has to be 30 days or more. That's when a tenant established tenancy. So that's really important to remember. Tenants still have the right to have visitors over, family members, whoever it is. That is your right as a tenant. You have the privacy to do that. And so many times we hear stories of landlords harassing people for having visitors over or family members. So that's very important to differentiate. Next slide, please. And then also, really quickly, under LARS, so as we know, right, right now we are currently facing a housing crisis, meaning that the homeless count, the increase of homeless people without stable housing or unhoused has increased. And one of them is obviously the high cost of living. I mean, our rent, the rent went up, right? 1%. 1% means a lot, especially for people that are on a fixed income. And so it's also really important to see that with a lot of this housing crisis going on, gentrification is happening, and people of higher income are moving into much lower income communities, and unfortunately many times community members that are on a fixed income or very, very low income or extremely rent burdened, meaning that they pay over 30% of their income towards rent, unfortunately are the most vulnerable. And so Thankfully, there are some protections under LARSO for people to be protected against evictions. And so there's two types of categories. The first one is when tenants are found at fault, and the second one is when tenants are not found at fault. I'm not going to go over them. I'm just going to highlight the two most common ones that we get here at our clinic. And so the one that's the most common when it's found at fault, meaning that the landlord has the right to evict you, and not a fault is that you're not a fault, and there is some protections that you have. Technically, what the housing department says is that you not paying your rent is a reason for you to get evicted. And what we at SAGE say is that it's not so much that you're not paying your rent, is that you don't have evidence to show that you've been paying rent. And what is evidence, right? Evidence means many things. Evidence means a receipt because you pay your rent, means that you pay your rent with money order or cashier's check. Many times we find community members, tenants, and extremely rent-burdened people, again, the most vulnerable, pay with cash. Why? Because many times the landlord harasses people and tells them that you can only pay cash. And under LA rent control law, that is against the law, and tenants can file a complaint. So, again, right, many times tenants don't know their rights, landlords take advantage of that, and people find themselves being evicted for not having evidence of them paying rent. And so that's a very common one. A very common one when people are, actually, next slide. Let's go to the next slide. Another very common when people are not found at fault under LARSO is when the landlord is asking for the unit where you live for them to live there, essentially, right? So there's two things to that. One, it really depends how long you've been living in the property. It also depends if you're over the age of 62, and also if you have a disability or have minors. The biggest difference between at-fault and not-at-fault evictions is essentially when you're found at no fault of your own, there is relocation assistance provided to tenants, and this amount varies by the time of how long you've been living there, if you're over the age of 62, if you have a disabled person or a minor. So it's case by case, and that amount just went up actually. It could range anywhere from $7,000 to $21,000. And I really want people to understand that although that might sound like a lot, these are people's homes. These are people that are ending up displaced because the landlord wants to get rid of them. And so there is a case-by-case thing, if the landlord wants to move in their family, it has to be the immediate family, meaning that it has to be their spouse, their children, their parents or grandparents, not their friend, not their neighbor, et cetera, et cetera. And also people that have long-term tenancy, meaning 10 years or more, or over the age of 62, technically should not and could not move out. So that's more of the information and the advocacy that we provide here at SAGE. Next slide. And I'm going to close up by saying that the landlord essentially makes a lot of moves to get rid of people. It is no lie, given that this is about money. Unfortunately, for many of us that are renters, long-term tenants and renters, where we live is our home, but unfortunately for the landlord, it is a way of making money. And so they do use a lot of illegal tactics to evict people, to make people's lives harder. And so, like we always say here at SAGE, today starts with the plan. Move your plan. Tomorrow is your barbecue. And next thing you know, it is a 3-day or 30-day or 60-day notice saying you have to leave. And so, again, that's part of the things that we always advocate here at SAGE. We do not provide a service. We teach people how to defend themselves and advocate. Last slide. And also just to wrap up, I do want to say that as part of the advocacy and the connections that we have with St. John's and Esperanza, we also teach people on how to file complaints with the Department of Housing and also the Department of Building and Safety, especially if there is illegal construction or construction that does not have permits, garages, and so on. And obviously with the Department of Public Health, especially if they're dealing with mold and infestations. Again, we try our best in developing tenant leadership so people, fight with power, not fear, especially during these critical times. It's important for people to know the right and have the right to stay in their home, right? The right to a safe, healthy, and accessible home. And that's a little bit of the work that we do. We do a lot of organizing, and also right now we're picking up speed with the Right to Counsel campaign to ensure that everyone that's going through eviction has legal representation, but most importantly, that advocacy and leadership starts before people get evicted. And again, fight for the right to stay and the right to live in a safe, healthy, and accessible home. And that's all I have for today. Thank you.
Thank you, Eina, and welcome Marjorie from Esperanza to discuss home visiting while focusing on healthy homes.
Good morning. As Consuelo mentioned, I am Marjorie Aparicio, Community Health Promoter of Esperanza Community Housing, and I have been working in the Healthy Homes Project for 18 years. First, I'm going to be talking about the Healthy Homes history. Next slide, please. Initially, the Public Health Department identified the Census Tract 2244 as a high-risk zone for lead poisoning. Because of the lead level in children who live in this census came out with very high results. Due to this, it was urgent to reach out to all these families. Mm-hmm. In order to start the outreach, Los Angeles County provides a grant to Esperanza Community Housing. To make this project possible, in 1998, the Healthy Homes program was launched as a pilot to reach out residents of the Census Tract 2244. At the same time, we began our relationship with St. John's World Child and Family Center. During that time, Healthy Homes did outreach door to door. We educate families about lead poisoning. Each family was visited and had child, and if they have child 6 years and under, we provided tickets that could be used for a lead blood test in St. John's World Child and Family Center. This ticket is now a formal referral form. When I was doing the outreach, I realized there were many barriers, but personally, I found out that it wasn't easy for the family to open their doors. I had to go back many times at the same address and try to convince them to accept our services. Then in the year 2000, SAGE joined the partnership because Esperanza and St. John's noticed a need for tenants, organization, and advocacy issues. This partnership is still operating in South LA. Next slide, please. Now I'm going to be talking about my experience during the home visit. The first contact with the client is over the phone. I call to schedule an appointment for a home visit. If I am able to contact the client the first time, I try 4 attempts in different times and in different days. The client we visit are referred for different sources. Could be community clinics, nonprofit organization in South Central, but most of them are coming from St. John's Ward Child and Family Center. Also SAGE. We also receive walk-ins. When I am the home visit, I conduct a health and housing survey. I do a visual assessment to see the condition of the home. I look for chipping and peeling paint, mold, mildew, evidence of roaches, rats, and cleaning products, among others. For example, in this picture, you can see evidence of roaches and harmful cleaning products. Many often, clients do not realize that the condition of their home are making them sick. After the visual assessment, I educate the clients about the harmful sources identified in the house. If there are issues with lender, we encourage the client to ask for repairs or changes in writing. If the lender does not respond to the letter, we refer the client to SAGE. Next slide, please. Now I'm going to give as an example a success story with the client, and her name is Guadalupe. Guadalupe was referred from St. John's because her son was bitten by a rat. She was enrolled in the Healthy Homes Project in 2016. On the home visit, I found out that she was living in a garage illegally converted. As soon as I entered the house, I smelled strong odor of rats. There were holes in the walls, and she didn't have a kitchen. She also mentioned that she has been fighting with the owner because she didn't want to make repairs, and besides that, she was being harassed. I referred her to SAGE. SAGE helped her to file a complaint to the Department of Housing. She won a court case against the owner. After the court case, she moved, and now she's living in a better condition. She's still in contact with Esperanza and SAGE and functions as a leader in her community. Guadalupe is an example of a great team that forms this partnership. She took advantage of all the tools that were offered to her, and she herself took the leadership of her case and fought for her rights until they were rewarded. Thank you.
Okay. Thank you, Dr.
Hello, everyone. We'd like to thank our speakers today, Dr. Belor, Edna, and Marjorie, for wonderful presentations. We'd like to open it now for question and answers. We received a couple during the presentation. Our first one here is, and this might be for Dr. Belor, does an asthma patient need to see a specialist, or can a PCP manage the asthma?
Hi, good question. PCP can definitely manage the asthma. PCP is probably better because PCP can see the patient more frequently than a specialist. The specialist can help a little bit. For example, like an allergy specialist can do some allergy testing and help interpret those results. But it's not entirely necessary because, as I showed on the charts, we usually know what kids are allergic to without even testing for it. Like 40% of the kids with asthma are allergic to cockroaches and dust mites and mold, and these are just really common allergens and things that we know we have to address even without the patient seeing a specialist. So from my experience, specialist is not always necessary, but and transportation issues also make it hard for patients to go to specialists. But it's definitely something I do sometimes. A pulmonologist can sometimes. A pulmonologist is good for explaining the importance of the medicines and breaking down the different medicines. They can do some lung function tests sometimes. But I would say the specialists are kind of supplemental. The main management would be the PCP. Yeah.
Okay.
Great.
Marjorie and Gabby, is Healthy Home being covered by grants?
Yes, we have different funding sources. In the past, we have had several HUD grants. Currently, we have a couple of Kaiser grants and a UCLA Packard grant.
Okay, thank you. Aina, what result do families have when they rent and have issue with mold, but the landlord won't do anything?
Edna?
Yes. Can you repeat the question one more time?
Yes.
What resources do families have when they rent and have issues with mold, but the landlord won't do anything?
Okay, that's a very common question. Thank you for asking. So we've had many cases where people do have a lot of mold. And so I do want to make a distinction, a really quick one-on-one distinction. So whenever people say, I have mold, we have to take a step back and really have a distinction between mold and humidity. As soon as you say, and the reason why is because there's many ways in which we can support people through the advocacy, the self-help, and obviously through the local agencies. So whenever people are having, so again, right, like we really want to ensure where is the mold coming from? Is it from a broken, leaky pipe? Is it because there's no fan in the restroom? Is it because the second floor or the second floor's pipe broke? So we really need to take a step back because depending where the community member lives, and hopefully they are protected by rent control, we're going to navigate different routes, right? The first one would be depending on the lack of repairs. Is there anything that's broken? Anything that's broken, and depending on what's broken, are there any permits that need to be finalized through the Department of Building and Safety? 2, is it mold because there isn't a fan in the bathroom? So that would be through the housing department. And so that is called humidity. There's a humidity issue. And so the minute you say there's a humidity issue, it becomes a code violation, meaning the senior inspector, so the inspectors through the housing department can step up and cite that as a code violation and essentially force the landlord to make the repairs. Now, if people are having severe mold, meaning it's humidity, but it's also mold, then the support that we provide there is by documenting it, and you always want to document it regardless, right? You want to take pictures, you want to take a video, and file a complaint with the Department of Public Health. Now, unfortunately, through the Department of Public Health, the Department of Public Health does focus a lot more through restaurants and other businesses that do need also some health codes that need to be processed or they need to go through. And so there can be a little bit of a challenge filing complaints and having the inspector through the Department of Public Health go and document it and cite the landlord. In terms of holding the landlords accountable, there can be a challenge because many times landlords don't do it and they're going to get away with it most likely. And so it really depends. If this is a big building, then does that mean that we can organize? Or it could mean that we can organize the tenants and organize the tenants to organize together and demand those repairs to be done. There is also an affirmative case, right? So a potential lawsuit, depending on how many people are being impacted, minors, people with asthma, any other types of allergies. So there's many ways. There's also a deduct and repair, which we don't always suggest that to tenants because it can be very risky, meaning that could lead to an eviction. But it also means that if it does lead to an eviction and you have really good evidence that you've been advocating for your right and you've been holding the landlord accountable and you've been filing multiple complaints, that could also help you present your case before a judge and obviously get compensation or potential relocation. So it's really case by case.
Thank you for your participation and your questions. Edna, we have another question. Will Sage be incorporating the Healthy Homes model in the Imperial County?
Imperial County, is that in San Diego or?
Like Kern County.
Okay. So we at Sage mostly do the work within LA City and specifically in South Central because that's where we are based. But we also support people in other parts of LA City and also LA County. During that presentation, I mentioned unincorporated. I didn't get to talk about it. So that means that as of early this year, LA unincorporated areas, meaning areas that don't belong in a city, are protected under rent control in LA County. And so we also provide support out in the Valley, San Fernando Valley. And we actually just connected this weekend. There was an event, a tenants power in Southern California gathering, and we connected with some folks out in Ventura and Oxnard. So we are more than happy to support and share our model. We've compiled a lot of templates for self-help templates, so tenants learn how to write their letters. The only challenge when properties and tenants don't have rent control under LA City is that many times there isn't enough things to back them up, but thankfully we still have state law protections, such as, a 60-day written notice for tenants that have been living there a year or more, right? 30 days if they've been living there less than a year, and other protections too, specifically around code violations. If there's lack of repairs, the tenants do have the right to withhold rent, but I would suggest for people to do it in a way where they have support, so that way it doesn't backfire on them. So I'm more than happy to support and share our model in other areas of California, within LA County or outside of LA County, especially if folks don't have rent control. Again, regardless, you still have protections. There's just a very different way in which you have to approach that.
Thank you, Edna. I apologize. I know we went over the time, but if Dr. Ballur is still on the line, we have one more question for you.
Yeah, sure.
Dr. Ballur, what factors have been the most helpful in improving care coordination, such as linkages with CBOs, partners, or other partnerships?
So, like, what factors have helped me connect the patients with the healthy homes more?
Correct.
Okay. So my preferred method is really to give them your business cards and really emphasize that you guys are on their side and understand all their issues and try to reduce their fears that they're going to get in trouble with the landlord just because they contact you. And sometimes I have to like remind them and repeated times, like, oh, you should really call Gabby or Marjorie. But yeah, that's I think that's the most effective way I get them connected to you guys. Give them a business card and really encourage them to call you guys. What else? Yeah.
Okay.
Yeah.
Thank you again for joining today's webinar, and thank you to our wonderful presenter for sharing their knowledge and expertise regarding healthy home and asthma. Thank you so much.
Thank you, guys.
Thank you.
Please remember to do the survey at the end.
All right.